And take us live on Facebook. I talked to Diane, but I'll tell you that later. Yeah. Okay, we're going live. We are live on Facebook.
Oh, we're live on Facebook. I need to go change my shirt.
Well, if you want to change it, now's the time.
Okay.
We're going live and we're just going to hang out till people come on. I'm not sure who's going to actually come on the Zoom with us and who's going to
Okay.
come. Oh, actually, we're not live yet. We're not live yet. 1 second. Hello, Kevin. Let's see. I can't. We're just hanging out waiting for people to join us. Hey, Nicole.
Oh, wait. Hey, Ricky.
Hey, how are you? We're just hanging out waiting for people to join us. I'm about to take us live.
Okay. I'm about to get in the house.
I'm looking for the hashtag. Hi, Emily. All right, we're going to go live in a second. Yep.
Okay. I'm here. Ooh.
All right, going live.
All right.
I think people will continue to join, but we will go live. We're live.
Good morning.
How are you guys? Hey, Nicole.
Hi.
I'm not sure who exactly is going to come on our Zoom, but I invited you guys to all come on to talk about screening. We're going to talk about screening because COVID is going to go away way before cancer does, right? And so we're so honored to have been invited by the Biden-Harris inaugural committee to celebrate this MLK Day and talk about cancer screening. We're doing day of service events all over the country, and we just happen to be one of the nonprofits they picked. I'm so excited about that. So I actually kind of invited a bunch of my friends as stakeholders, and hopefully more people will come on the Zoom, and we'll see who comes on our Facebook Live. If you want to come on the Zoom, just put a comment in the Facebook Live and we'll let you on. But we really just want to, brainstorm what we can do to get more people to get screened. And we don't have a lot of data because it changes every day. People are dying every day of COVID. But the last data I heard about right before Christmas was that mammograms are down 75%. And colonoscopies are down 60%. Dr. Keith, do you know anything about what's going on with PSA testing?
The same thing is that they're down. We don't really have statistics on how much they're down. It was just that everything, what type of cancer screening, any type of cancer screening has been delayed because it wasn't a priority. It wasn't emergent. So
Yeah.
I put it in the same category as everything else, that there's been a delay in screening, and slowly before the second wave hit, people were starting to increase the screening, but now we're back in the same scenario where they're going to prioritize the treatment options that are available.
Right. I really think that, I know things were closed for a while. So I know that, you couldn't get, even some of the cancer surgeries were postponed. A lot of the cosmetic surgeries were postponed. But that was, I think things have pretty much opened up since really July, definitely since August.
Right. But now that you have this second wave that's hit, and a lot of the places
they don't really have the manpower.
Yeah.
They don't have the
They're having difficulty dealing with the patients that are coming in now.
Yeah. Hi, Laura. How are you? We should,
Hi, Ricky.
this is like so informal. I mean, it's really like, I just wanted to I just really invited a bunch of my friends and breasties to talk about screening. And I'm not sure it's even we're live on Facebook, so I hope we have an audience. We had about 20 participants registered for the event on the Biden page. So, and then I just invited my friends onto, the Zoom. So everybody want to introduce yourselves? We lost Janice. Emily, you go first.
Great. My name is Emily Powers. I am a writer and content contributor, and have a family history of breast cancer, so very involved in that landscape. And I'm excited to be here today.
Yeah, and Emily just joined our team. And what's your title? I love it.
Oh, health storyteller.
So she's going to help me write. I love to write articles and publish and stuff, and I just can't do it all. So she's going to help me out doing that. I'm really excited about that.
Me too.
Great.
Yeah. So Dr. Keith, you go next.
Oh, well, again, I have a family history of prostate cancer, and I'm a Black male. So just being a Black male, I'm at high risk for prostate cancer. I presently is the director of clinical trials and education at Prostate Health Education Network. And I've also been working closely with the breasties to make sure that we screen, make sure they understand the importance of clinical trials as well as bone health. And so I'm a firm believer that the tide raises all boats. So we pitch in together, we lift everybody up. Doesn't matter what cancer it is.
Great. And Dr. Key is one of the few men I've let on my show. The doctor is in, so he's very privileged.
Thank you. But she wouldn't send me a shirt though. I'm still waiting for my shirt.
We'll have to get you a show and then get you a shirt. But also we are going to do on the doctors and I think it's going to be on, what do we say, February 17th. We're actually going to do a show about a husband with prostate cancer with a wife with breast cancer. Because it's so, it's very common. The disease is so common.
Yeah.
So.
And that was so interesting is that the wife is the caregiver, and the husband obviously with prostate cancer, And then with the new trials that are coming up, we have pushing out survival 10 years if it's detected early. And that's a very important point. Why to screen, early the detection, the longer the life.
Yeah.
And then and we were doing a survey, and I started looking, I said, well, that about 50% of the people in our survey, their caregivers ended up having breast cancer. And I said, wow. Yeah. So again, it didn't click, but I think that that's going to be very important. And that's why we have to work together as a team and support each other. Whatever I have, I'm passing it on. And if a person has a question about a clinical trial and you need for me to look it up or find it, I'm at your disposal.
Yeah. Thank you. Thank you. Laura. Laura has some really cool stuff going on.
Hi, I'm Laura Shavery, and I work at a company called Blue Note Therapeutics. We're developing tools to address cancer-related distress for people with cancer, and eventually for their caregivers as well. These are digital tools so that there are psychosocial services available for people with cancer, but largely the people that have access to that are people who are treated at large cancer centers with great insurance. And we want to make sure that the science behind psychosocial stressors when you're dealing with cancer are available to patients no matter where they're treated. So access is something we're trying to solve for by creating these digital tools. I'm the head of patient engagement there, and the way that I got into this work is I was the primary caregiver for my grandfather and his 4-year battle, if we can use that reference, with prostate cancer. And his mother, who I grew up with, was a breast cancer survivor. And my father right now has prostate cancer. But it was really caring for my grandfather while I was in college that led me to get my master's in social welfare, and ultimately worked in patient services in the oncology space for a long time, and then also in the biotechnology space with kind of traditional medicine. But super excited now over the last year to be working again exclusively with people with cancer, and specifically in the distress area, because it's just something that I'm very passionate about solving for.
And I've been one of her guinea pigs. I don't want to use that word because I love clinical trials, but I've been trying to help her actually figure out what the language should be. And it's been a really, really interesting conversation because I'm usually the moderator. So to be the patient is very interesting. It's very cool.
Yeah, it's been great getting to know you, Ricky, and
great work. Great work.
So fortunate to know you.
Love you dearly. Nicole. So glad to see you, Nicole. I haven't seen you for so long. I mean, the other Nicole, actually, we have two Nicoles. Nicole, meet Nicole.
Hi.
Nicole from Orlando, meet Nicole from Philly.
Delaware.
But either way, go ahead, Nicole from Orlando. You start talking, then we'll let Nicole speak.
No, my name is Nicole. I am 41. I have 2 young kids, 2 and 5. But I'm a new breast cancer survivor as of May 1st, 2020. And, I'm just love to be here and be a part of this conversation.
Cool, thank you. And Nicole, I haven't seen you in forever, Nicole, because we didn't have any events this year.
Right. Hello, everyone. My name is Nicole D. Surrett, and I live in Newcastle, Delaware, right outside of Wilmington. And
right.
Yes. In June, I'll be celebrating my 10th cancerversary as a breast cancer thriver. I am an inspirational speaker promoting health and wellness as a lifestyle with an emphasis on stress management. I believe stress played a huge part in my diagnosis, and I don't want women to wait until they get a diagnosis of any type for that to be the wake-up call to start paying more attention to their health and wellness practices. So again, my focus is stress management, and it's about self-care. I do believe that we are modern day superwomen dealing with a modern day kryptonite called stress. And we're so busy taking care of everybody else, we are not taking enough care of ourselves. And so that's the message that I am sharing with women.
Great. Janice.
Good morning, good afternoon. I'm Janice Johnson, and I had the honor and privilege to walk alongside Ricky as she was going through her cancer. I'm so thankful, but as a result of that, I feel like that I have a gift, but also an obligation to help others in that same area. So thank you, Ricky, for bringing all of us together, and please let us know how we can help and serve other people.
She went to every appointment with me. I'm sorry. Everyone. Yeah. And my other bestie's here too, Judy.
Hi, everyone. Happy to join you all and to meet such amazing people working in this space.
I ask you this.
And Lena, Dr. Lena, I'm so glad you're here. Dr. Lena is the medical advisor for Susan Love Foundation.
It's so nice to see you, Ricky. Thank you for inviting me. I feel like I've been having Ricky withdrawal because I haven't seen you since the webinar. But so I am a breast cancer surgeon by training, but I will be celebrating my 7th breast cancer survivor anniversary January 23rd this month. So I kind of stopped doing breast cancer surgery for a long time after my diagnosis, and after kind of the pandemic happened and all of the social unrest happened with the Black Lives Matter protests and all of that, I felt compelled to address the racial disparities in breast cancer in our country. And when we talk about that 42% mortality rate for Black women in our country, I think people are all shocked, yet we often treat it as if it's inevitable. So that's, I was happy to meet Ricky early in my days at the foundation because I know she's passionate about that same thing. And so that's my goal, is to help raise awareness about these racial disparities and to try to mitigate them.
Thank you so much. And she's doing really, really great work, So we have lots of work to do. So, our topic at hand is, I think there's some more people on phone, like Rita. I can see if you guys want to talk, please talk or come on screen, but it's really screening. So we know that screening is down, and we know that early detection is really our only protection against cancer, definitely breast cancer and most cancers. And we can't control, and I think Dr. Keith has all the numbers of how many people are going to get cancer in their lifetime. They're horrific, but I think it's something like 25% of the population will get cancer in their lifetime. But it's the stage that you get it at, it controls your destiny. And so there are a lot of things we can do if you early detect it. The more severe it gets, the harder it is to treat. So it's so important that people are getting their mammograms, doing their self-exams, and getting their PSA tests and getting their colonoscopy. So I just thought, we could talk about it and figure out what kinds of things do you think we can do to encourage people to get screened in this environment? Because people are really scared. Now it's getting worse, more people are dying. And even though the vaccine is coming, it's not coming fast enough. And the vaccine scares me a little bit. I'm definitely going to get it. But the fact that you can actually transmit COVID to other people means that you have to still have the same behavior that you have now, trying to keep safe, even after you have the vaccine. And I'm just people don't open up and start, acting crazy just because they got the shot, right? So, hey, Sophia.
Hey, Ricky.
Another great partner. So Sophia works for Citizen, one of my favorite partners to work with.
I was on the Facebook watching and going all the props about the importance of screening, because there's so many wonderful people already. So happy to join the conversation and echo the importance of what we're talking about today.
Yeah, no, I thought her get in here.
Really our best
I saw her out there. They come get in here with us. So
I've joined the party.
Anybody want to, talk about any ideas?
Ricky, I'll go. I shared this idea with a local breast cancer support group, well, not a group, one of the coalition groups here in Delaware, and they hadn't thought about it. So I know for my church, we are completely online. Every Bible study, every service, everything's completely online. And we have a health and wellness ministry at our church. My bishop, as well as my first lady, are big on health and wellness. They are trainers, bodybuilders, all of that kind of stuff. So that's very important to them. And they understand that really our health is our wealth. It's the core of who we are and what we're going to do moving forward. And my suggestion was, which I'm suggesting today, is that we approach churches that have health and wellness ministries and or cancer ministries as a means of getting the word out.
Yeah.
Even if they have women's ministries, you know, we've got to get the men's ministries as well, get the word out, you know, that, like you said, cancer is not stopping, you know, just because of COVID. COVID doesn't care and cancer doesn't care.
Right.
But we have to care about what we're doing and getting people to understand that a delay could possibly just be detrimental. And so, you know, I think many people are connected with some type of faith-based group that maybe that would be some way to get information out that maybe is a little kind of off the beaten path in terms of thinking outside of the box.
Yeah, maybe we can even figure out how we can go to like the head of the AME church, some of the top churches, and kind of like give them some sort of materials or education materials to educate people. But I think that's a good place to be because there's such a good trust factor there, you know? The thing is,
Hey,
we
Rick,
talk about
can
this
I
stuff
join?
all the time. Yeah.
Hi. Oh, excuse my granddaughter in the background, Yvonne here. I don't really work in this area as much as being one of your supporters. Yeah, that's Debbie.
Hi, Ella. That's Debbie. You know, my grandma name is Debbie.
But I was going to suggest, in line with what the person that spoke a second ago, is to maybe approach other kinds of, not just churches, but other community-based organizations, and to ask them what are their, you know, community service projects at the current time. A lot of people are looking for, you know, their regular course of work has been interrupted by COVID. They're finding other ways to, you know, exist and stay relevant, but maybe presenting this kind of activity as a community service project, whether it's the Y, the churches, you know, other kinds of, you know, organizations within the community that aren't functioning in their full, you know, breadth as normal, but this would be a great space for people to find a relevant way to contribute to their community.
I think that's a great idea, Ricky. And as soon as Yvonne started talking, I thought about our Greek organization.
Yeah.
Exactly. Because I'm a Delta, but Deltas, you know, we always have a community service project of some sort. So that's sort of all of the Greeks, but you extend it to the Y and to, you know, the churches and to community mental health Listen, mental health, community mental health bases are a great place because their constituents may not be as you know, connected and as on top of what they need to be in this time, right? Especially because this situation, I'm talking about COVID in particular, has thrown everything off, including where people, you know, who are people who have been displaced. And so now they're somewhere else, but how do you find them? And then still I'm off my routine. My routine is to get my mammogram at my birthday. It's what, almost February? I'm born in November. So I usually have a mammogram between November and December. I'm 2 months off. I already know that and I'm hyperventilating.
You should, because I'm going to come and take you if you don't.
I know, but you know, as conscious as I am of this, because I do everything around my birthday from the top of my head to the toes, right? And I usually do it the same day. It's very fun. But you know, I do. And I go start with the dentist, end up at the colonoscopy, right? You know, whatever. And everything in between, but I do it connected to my birthday. And I'm consistent, but I happen to move. So as an aside, but I've moved, but I'm just thinking about other people who have been displaced as a result of COVID, whether it's because they can't stay, you know, they've got out in their apartments, their facilities have closed, their normal environment. So of course, they're also their routine. And who are the most vulnerable? The people who are those who are, you know, don't have the means and who are detached and who are economically, you know, a challenge. So, and that's a great population.
I agree that, you know, looking for these community outreach opportunities is excellent. And I can say that as a patient that, like Yvonne, put off my screening a little bit because, and not just the screening mammogram, but the DEXA for your bone density. And, you know, there's many levels for different people, depending on where they are in either their breast cancer journey or in screening, people that are asymptomatic. But I have to say that I was afraid to go to the hospital. I didn't want to go to the hospital, right? And I think that the less connected you are to a hospital, the more afraid you are to go. And I think
you're
that
a doctor, and you're
I'm a doctor, but that's what I'm saying is that, you know, it's like, okay, you only want to go if you really have to. And that's the public health message that's been sent, right? Because we don't want to crowd the hospitals with people that used to go to the ER for things that don't need to go to the ER for. But I think it's important to communicate. Every time I've had to go to the hospital for a screening thing or a mammogram or whatever it was, the hospitals are not screening, they're not as crowded in terms of, I mean, the ER is, but not the mammography suite and not all the, and they really make it so that you're not waiting very long, you're in and out,
right.
And it does feel very safe. I didn't feel, you know, like I was procrastinating on doing some of the things. And then I was like, what am I waiting, you know, because I thought, oh, it's going to get better, right? And then it didn't get better, it got worse. And so my doctor was kind of like, you want to go now? And I'm like, well, I didn't go for 3 months, so now I have to go, right? And so I think that people need to understand that the risk of going to, you know, your outpatient mammography suite is very low in terms of contracting COVID, but the benefit of going, and if you do have something, some people are also hearing that, you know, in California, I live in California and I live in Los Angeles. So a lot of services aren't being offered right now because the hospitals are so full. But cancer is one of the things that's still being treated. So if you are diagnosed, it's not like you're going to be diagnosed and then you're going to wait 6 months till COVID ends for them to address it. Because I have met some women that have said, well, what's the point of going now? They're not even going to do anything about it because of COVID. But cancer is one of the things that they're really trying to keep on the, you know, if you need cancer surgery, they're still going to be doing that. So I think that it's important to get the message out when we talk, if we find places to do community outreach, that it's okay, that it's safe to go to get these things done and to wear your mask and bring your sanitizer. But I have to say that what I've seen in the hospital is they're very organized, and things have been easier to get done for me than they were before COVID, just because there's less volume for screening.
I agree. You don't have to wait, and they definitely check you out ahead of time. I mean, when I went for my checkup, I had to get a PET scan. I guess it was probably in July, and everybody you wait in your car till it's your turn. So it's really safe. And I just had eye surgery, and I felt very, very safe in the hospital getting eye surgery. I know that all the medical people are tested very frequently, and they sit you 6 feet apart. You don't have to wait in waiting rooms. They really are giving you care. I think we're getting better care because of COVID, because you're not going to that doctor's office where you may have to wait 30 minutes in the waiting room. So they're much more conscientious about it, and it's actually easier. So
I had a comment on the outreach in the community and leveraging churches and the fact that churches are online now. I wonder if we could piggyback in some way on like the social media that is happening, really, you know, every time someone gets their vaccine, posting it on social media, the healthcare workers, and, you know, something around like, while you're waiting for your vaccine, do something else for your health. And, you know, maybe
That's
it's
a
like
great idea.
granddaughters driving their vaccinated grandparents to get their mammogram, and, you know, deciding that, you know, what the heck, I'll get my first screening as well, or daughters taking their moms, that, and posting pictures of, well, I did this instead, to kind of bring in, you know, the maybe some grandmas who aren't on social media, but bringing in, you know, other generations in the process to have a broader reach than with their posts.
That's a great idea though, like do something else for your health while you're waiting, right? I love that. And the grandma thing, you know, I really believe, you know, I'm sort of counting on young women and really having this conversation with young women, because to me, they are going to be the conduit to the family. Hey, mom, did you get your mammogram? Hey, grandma, let me take you to get your colonoscopy. Hey, grandpa, did you check your PSA? And as like a voice for the family. But I think that's definitely great. Well, I think we should definitely do some outreach. And you know what? Maybe we can like make a video that people could share at their Lynx meetings or their Delta meetings about screening. So, Dr. Keith, you got to help me with that for the men. Let's make a video. You're on mute. Wait, are you talking?
There we go. Sorry. Ricky and I are always thinking in so many different directions. To kind of give you an update, so I'm from an HBCU, and I am a Greek also. What we have approval is, the whole concept is centering around HBCUs. Not saying that this can't be done at non-HBCUs, but using HBCUs because you have men and women who come from small towns and communities, using a seminar series that introduces the patient, the freshman student, to cancer, to prostate cancer, to breast cancer, talking about, and something that I wanted to revive with Ricky, and I haven't really asked her to do it, but she had a program before at an HBCU, a ladies HBCU, that kind of discussed those topics that women couldn't discuss with their mom. And then which part of it means breast cancer. So at Prairie View, what my objective is, and I did find a bus, Ricky, too.
Did you? Okay, we can talk about that. Great.
Yeah. So the objective was, as the freshmen come in, there's a freshman seminar series that talks about health, breast cancer, prostate cancer. That's what we push. So these freshman students become the ambassadors for cancer care for their community. And then our overall objective is, as an ambassador, they may get a scholarship or a stipend from a big pharma to continue it on. But each year you get these new ambassadors come from different areas throughout the country. In this case, since we're in Texas, outside of Houston, the bulk of our population is coming from outside the Houston area. So these people can go back. What's very nice about what's taking place with COVID is people who are not comfortable with being online are comfortable now.
Yeah.
So that means Zoom. So now we have the ability, because we took lemonade and took a lemon and made lemonade, and now we have a better way of disseminating information. And so being able to help people understand, have video libraries as it relates to cancer, and then use whether it's your Greek Panhellenic Council to really drive it. This is Joe Biden was responsible for the moonshot funding, which is about $1.5 billion in funding. And right now, from a policy standpoint, and funding new great opportunities like what Ricky has been proposing, is we have to be very aggressive right now. Right now, we have 4 years. And so we need to work together as a team to really roll out cancer education. And one other point I wanted to make, and there's someone that said it earlier, women are super women. And you talked about the kryptonite and I'm saying, and it's very difficult for women to be vulnerable. And so the psychological aspect has to be incorporated so you have an opportunity to be vulnerable. Women are fighting to be perfect. One thing wrong compared to the 1 million things that you do correctly, you get that there's that focus. I want to shift that around, and it's all right to be vulnerable, and let's get your care underway. So those are kind of where, I know it's kind of a high level area, but those, the messages that I plan to get out at Prairie View. So I have next Wednesday, not this Monday, well, next week, matter of fact, I'll start the seminar series, and we're going to talk about those topics, and hopefully I'll be able to have Ricky on to come in and talk to students about breast cancer, and then continue to drive this message home.
Yeah, we're actually going to expand our internship program. We did have 5 interns. We're going to hopefully do 10 this year, and get them on the campuses. And what the kids did was really interesting. They did like a pre-poll on Instagram to see how many kids on the campus knew how to do a self-exam. And when they first did at the beginning of the internship, nobody knew. And they were so surprised that their friends hadn't talked about it, but they hadn't really talked about it. And then by the end of the internship, 6 weeks later, they did another survey, and it was like 70% of the girls were doing self-exams. So they were really proud of themselves that they had brought the information to their campuses, but we can't do that alone. The other thing that we're working on is our pink tabletop conversation. So we're working with the Triple Negative Breast Cancer Foundation to go into people's houses. I mean, virtually now, ideally would have been for real. And we kind of stole the Jada Pinkett idea, the red table talk, but literally trying to bring the breast cancer conversation to the kitchen table. And so we've got our little mugs and masks. I need for our pink table talk. So the next one actually, I think, is on February 7th, and we have Dr. Lori Wilson's family, but the ones we've had has been the mom, the daughter, the auntie, the sort of the matriarch of a couple of women in the family where, like, don't tell your brothers about my cancer, keep it in the girl.
Yeah.
Or like, don't tell, and a lot of women just don't want anyone to know they're sick because people depend on them, and they don't want them to feel like
that's a lot of pressure.
A lot of pressure.
And it's just that's that whole mission to make sure women understand it's all right to be vulnerable, but the people around them have to understand it's okay for women to be vulnerable.
Right.
And you have to step up to the plate and then help, participate, be nurturing and supportive.
Yeah. Hi, Diane, you joined us.
Hi, yes. Have another meeting.
Yourself. We're just talking however. It's nothing formal. Go ahead.
I have something to add, if that's okay. I'm a veterinarian, and when I see patients, especially for either just screening, making sure their overall health is good, we're kind of like a one-stop shop, unless we get to a point to where medically it's a case where we need to refer out. I find, though, as being a patient more so now, being a breast cancer survivor, you have so many doctors. You see one doctor and it leads to another and leads to another and leads to another. In the midst of this pandemic, there's another heightened sense of you don't want to go see so many people because of the exposure. Right. And I'm sorry, did I cut out here? Okay. And so I bring this up to say, my mother, for example, she needs a mammogram, but she can't go to get a mammogram without seeing her general physician. And she has to schedule to see him. And because of everything with COVID, the scheduling is more intense because they don't see as many patients.
Right.
And so the time that she gets in to see her physician there's a huge delay. And then by the time she sees the physician, which hopefully will be by next month, she has to schedule for the mammogram because she has to get the referral. So I don't know if there's a way to kind of break down the pathway a little bit, because I think that nowadays people are not even going to get their teeth cleaned, you know?
Yeah.
Right.
Well,
Things that
I
are
I think that one thing that maybe your mom can push for is a virtual visit, because I would think that her
Yeah.
primary care doctor should be happy
Yeah.
to refer someone. You know, I think people are doing things a lot differently now, and so whereas before we wanted the patients to come in so we could do a breast exam, now we're like, okay, well, maybe we can't get that breast exam, but that doesn't mean we're going to skip you for a whole year or however long it's going to take. So I would encourage, for any appointments that anyone's avoiding because they don't want to go in person, that you reach out to your doctors and try to do as much as you can by telehealth. And
Yeah.
just like Keith was saying, a lot of things are being offered virtually that weren't before. And it may change the way medicine is done for a long, you know, for the future, because there are a lot of things that we go into an office for that we don't, sometimes the doctors don't even touch you. So they don't even examine you. So I would encourage you in your care, and also to encourage your mother, that if you guys have providers that aren't offering that are telling you that you need to come in, to say, hey, you know what, I'm really worried about my COVID exposure or my mom's COVID exposure. Can we this year, can you just order it for me, and then we'll come in when things are better, or, you know, but also to encourage you that if you do need to have something done, like we said earlier, that things are being done quite safely, and that you're not in the same waiting rooms with COVID patients and those kinds of things, but that of course that you must wear your mask and everything else. But I think that a lot of things are being done virtually. So I would encourage you to try to reach out that way.
So that I just want to add on to that 1 second, that, and I know in Houston, and this is that with telemedicine, people are being seen, and since blood work or since mammogram screening are independent and maybe outside the medical center area, that you really don't have to go in anymore. I mean, I have a good example where somebody had prostate cancer screening, didn't touch the patient, and they just wrote a script to go out to the LabCorp in the area. In this case, in Massachusetts, we have diagnostic facilities that are independent diagnostic facilities where you don't even have to go into the hospital. You're online, the doc will write a script, and as long as you get contact with that diagnostic facility, that screening facility, and maybe there's going to be I mean, I know it's different in different communities, and maybe we need to start bringing back some of those mammogram buses, some of those, because this is the time that we're going to have to be as creative as possible, because the objective is to save women's lives.
And on that objective, I think from your story, Nicole, we're kind of getting into another education opportunity. And could that be, you know, on the list, to provide education about how things are different and in some ways better for accessing healthcare. I'm a twin, and my brother has had some pretty big challenges in the midst of COVID related to a foot ulcer. And he has managed Medicare because of disability. And I've, you know, so he struggles in the way that you're describing, Nicole, with the requirements for referrals and, you know, the whole bureaucracy of it. But we've been able to get those referrals really quickly from the PCP, which is a total change, because they don't want to see him. You know, they're like, yeah, okay, I'm willing to turf this to the next specialist in a way that, you know, they haven't been in the past, because they're supposed to be gatekeepers, but also because it's totally legitimate. Like, he needs that care, and your mom, you know, is within guidelines of needing annual mammograms. So if we can let more people know, like, demand it, you know, if you have to have a telehealth visit, fine, for them to be willing to refer, but that appointment needs to be soon.
Yeah, I mean, timing is everything too. You know, I know my docs told me that if I had gone in a month earlier or a month later, I would be dead. That's how aggressive my triple negative was. That she said if I had come a month earlier, so they probably wouldn't have seen it. And literally by the time I had from my biopsy to my surgery was about 3.5 weeks, and it was already in my lymph nodes. And we don't really know what would have happened if I had surgery earlier, but it was definitely going fast. And so, you know, I know I'm so blessed to be here, but we don't know, you know, you never know. I think you just have to do it and have the courage to do it and know that it's more important to do this than worry about COVID right now. I mean, we all have to worry about COVID. I'm saying don't worry about COVID. Be safe, wear your mask, you know, take your sanitizer, and there's sanitizer everywhere in a doctor's office. So the one thing funny is like I go to the eye doctor a lot because I had eye surgery, but they take your temperature. Like, you know, when you walk in, that's a crock because my mom had COVID. She never had a fever. But I still think some of the symptoms of COVID are still so crazy, depending on, you know, what your situation is, that they really can't tell, you know, whether you have it or not. And now once you have the shot, you can still give COVID. So just have to be really careful and not change what we're doing, you know.
And then there was one thing, if you didn't mind me, so I did write, there's a couple of things. I'm very a strong advocate for vitamin D.
Yes. Talk about that.
So back in March of 2000 of last year, I came out with a Facebook Live press release as it relates to, well, let me kind of backtrack a little bit. So as a faculty member, I was faculty at Harvard, and I was responsible for medical countermeasures for emerging infectious disease. So I was basically responsible for developing platforms and over-the-counter therapies for, in case you're exposed to a biological weapon. So that's kind of where my background comes in. And so the reason why I bring up vitamin D at the time, there's vitamin D, the majority of people, especially Black people in the United States, are vitamin D deficient.
Yeah.
Okay. And then the darker your skin hue, the more likely you're vitamin D deficient. Or if you use a lot of sunscreen, you're vitamin D deficient. The other thing that comes into play is that as we get older, the majority of Black women and Black men are lactose intolerant. So I published a newsletter in November or December, because there's a relationship between cancer and vitamin D, and especially from the standpoint of augmenting your immune response, so it can better fight cancers. But also, there was a clinical trial out of India that demonstrated that high concentrations of vitamin D decreased the length of exposure to the virus, but also your chances of dying from COVID are 4 times more likely if you're vitamin D deficient. So there's a relationship between cancer and vitamin D deficiency, which I'm pushing, and also prepping yourself, being ready to go to the doctor. And that means optimizing your immune system so you're ready to go. That's what I talked about last year about what do you need to do as a cancer patient when you're going to your doctor. You have to communicate with your doctor. If you're a Black woman, you are at high risk. So you have to communicate. If you're having a problem communicating, call Ricky.
Yeah.
Ricky will write a letter for you in a minute. And they'll be calling you up. So, but we have to be aggressive. We have to be confident. And it's the one message that I want all women to understand is the technologies that are coming down the pipeline are amazing. And I saw them as a graduate student, but now they're coming out as clinical therapies, immunotherapies. There's some great things that are coming. We just need you to get screened early. The earlier you're screening, the longer your life expectancy, the longer you can live.
Yeah. Yeah.
So I'll get off my soapbox.
Thank you on your soapbox. I love it. The vitamin D is critical. It really is. You got me taking it. So, and I'm in the sun all the time. You guys know that on my paddleboard, but I still take it. Diane just brought up a topic in the chat. Diane, why don't you talk about it, babe?
Hi, everyone. I didn't know if I had missed this part of the discussion or not, but I know it's a huge concern for individuals in our community. In fact, I got a text from a friend of mine whose sister-in-law was diagnosed recently triple negative, and she has lost her job, due to COVID. So she doesn't have insurance, but she's trying to find resources and how do you get coverage? I mean, what's available in these communities when you have individuals that don't have insurance? What's available to them? And where do they seek treatment? And are there agencies out there that will help them get the care that they need and fund that care? And I know it probably impacts the Black community, especially women, even more so. And
Yeah,
I don't know if anyone had any ideas on that particular piece or not.
I'm looking up there's a fund in Atlanta. I think it's PAF. I'm looking it up, Public Advocacy Fund, and they do have I'm looking up, I'll put in the chat, but they do provide resources to breast cancer patients.
Mm-hmm.
And it's in Atlanta, and they are very, very responsive. We actually just helped a woman during the holidays. I had a call from a young woman, 29, 5 kids, stage 3B, HER2 breast cancer, and homeless. And we helped her get an apartment, and they were very helpful in terms of helping her seek out funding. I will find it and put it in the comments, the name of it. I can't think of it right now. But they do really, really good work. And there are a lot of state resources. You just have to look out for them. And if you call us, we'll help you. If you call Touch or email us info@touchbbc, we'll try to help you find the resources for you.
Okay.
Okay. But it is really hard right now because so many people have lost their jobs and lost their insurance. And I mean, and even with people with insurance, it's stories I hear that break my heart. I got a free mammogram because I have Obamacare. So you can get a free mammogram, but guess what? The result comes back funky. And they say, come back tomorrow to get an MRI or to get a PET or whatever. And guess what? That treatment is not, that diagnostic treatment is not covered by insurance. So what do? They let it go because they can't afford $1,800.
And there's something that's I was looking for it off my fingertips, but I know that there's a pandemic unemployment insurance.
Mm-hmm.
And then there's some pandemic related programs related to health assistance also. I know obviously may vary from state to state, but if we can get the state where the person lives, maybe we can do some digging.
You're in Texas.
Oh, okay. Well, okay. I'll work on that right now. I was like, I'll work on Texas. I'll get some information for Texas and I'll pass it on to Ricky.
Ricky, I'm also going to drop into the chat the F Cancer Foundation. They have a free patient navigator program. Patient navigators, social workers can be life-changing in terms of helping patients navigate all of their options, foundations, grants, assistance, because just having to go out and search for that when you are sick or in a tough spot is hard. And so having someone who's got your back, who can help you walk kind of each step, can be life-changing. So I'll drop their free patient navigator program into the chat of the conversation, but highly recommend them for anyone who needs help.
Great. And the one I was looking at, Sophia, thank you, is the Patient Advocate Fund. And I put it actually in the Facebook chat. You should put your thing in the Facebook comments if you would, Sophia, for the Facebook audience, but it's patient advocacy. And there's also something called the Pink Fund, Molly's Fund, where they actually provide resources for, I think, like three months or so for breast cancer patients, but it's called the Pink Fund, and it's thepinkfund.org. So there's stuff out there, and we can try to help, but it's the way I look at it, I call these my $500,000 fake boobs, you know, 'cause it wasn't cheap. Right.
Diane, I put it in the chat, but
I
just,
see it, Laura. Yeah.
okay. So similar to the Patient Advocate Foundation, PAF, the thing with PAF is a lot of people access their funds who have Medicare because it's their foundation funds are the only way that people with Medicare can get assistance with copays because it's government insurance. But pharma companies, speaking from experience, because I actually ran this function at Genentech, they do, if as long as the patient is on one of their medications, they will, they have the ability to provide assistance for free product for one, but they also often employ really great navigators who can figure out like, if they can help. Yes, anyway, just reach out depending on what medication she has and who the manufacturer.
Well, literally, she was just diagnosed last week. And so she's like trying to navigate getting doctors, you know, all she's at the very beginning.
Well, call me tomorrow.
You mentioned that.
Okay, Ricky.
Call me tomorrow and we'll figure it out because we also have a volunteer that works with us a little bit, Valerie Buxton Punch, and she actually works at Johns Hopkins, but she's a phenomenal navigator, you know, in terms of giving, you know, helping with resources. And so we can get her to give you some advice as well, because she's really, really good at, you know, finding the, you know, finding resources at different hospitals and helping people figure it out, you know. So we can get Val on the case for you, but call me and we'll figure it out, help figure it out.
So Ricky, you said you had put it on the face. I saw it in our chat here. I didn't see where you had posted, Ricky.
I put on Facebook, but
oh, it's on Facebook.
Yeah.
Okay, I'm not on Facebook.
But yeah, it's patientadvocacy.org. I'll send.
Okay, got it.
But yeah, there's still stuff out there, but it's, you know, it's kind of a sad state of affairs, you know, that, you know, and I'm hoping one of the things that you know, I was blessed to be invited to the Biden-Harris transition team for Black women's health. And so I guess our next meeting will be the real staff because they'll be all, you know, in their jobs by then. But they've been very, very open to talking about cancer and really all the diseases that affect us and health disparities. So I think the administration is really going to come through and do some good stuff in terms of, you know, helping communicate about resources, provide resources, and talking about clinical trials and all the stuff that we sort of have on our plate. I think it's going to, you know, be a good conversation with the new administration. And I will take advantage of every opportunity to talk to them and be involved, you know it. So, and I'll bring everybody in as I can. But I think it's really, the fact that they even had the conversation before they got into office is really, you know, says a lot about them, you know. So I think it'll be a good time, a better time for our health situation. You know, one of the you know, few good things about COVID is all these health disparities we've been living with for years are now on the table. The other thing that I always bring up in these conversations is that, because we start talking about stress, but 77.3% of Black moms are single moms. That's huge, right? So add any disease to that, and what do you have? You have the superwoman mom with the cape on trying to feed her kids, right? So that's always going to be her priority at the expense of her own health, and definitely at the expense of her mental health and her emotional stability. So we also just have to be really encouraging, and when I say that, give that back in like any kind of forum, which I do all the time, people are shocked. And when you start thinking about what that really means for a mom, you know, to get breast cancer at age 40, age 30, age 50, whatever it is, when she's got to take care of her kids, you know, she's a full breadwinner, it's a lot of stress, which just exacerbates whatever disease she has. So.
I think I want to piggyback what you just said, Ricky, if you might, because I was 40 and I found my breast cancer, my lump, breastfeeding, my 9-month-old at the time. And You know, I pacified it off at first as a clogged milk duct. And if it wasn't for that persistent, you know, I do have a medical background. Again, I'm a veterinarian, but, you know, if I was a normal average person, I think I would say with no medical background, I probably would have passed it off longer than what I did and not got it really looked at, because it didn't really bother me. You know, it was just small and
yeah, it doesn't hurt. Yeah.
and it didn't hurt at first. And it was only because I was manipulating it that it became tender. And I was like, it's not going away. It's been 4 days. Let me go in and have it checked. So I just resonate with a lot of people right now who may be passing stuff off. They may be fatigued and not realize maybe something's going on with them. You know, they may be having changes in their nails or hair. You know, that's what I was. I didn't have changes in my breast. I just had changes with my nails and hair and fatigue. But I had this breast cancer brewing. And so I think that, just to piggyback also with Crawford, I think Keith said about maybe the mobile buses. That's an awesome thing.
Neighborhood, yeah, yeah.
I've never seen a mobile mammary bus or a screening bus. I see a lot of the red blood bus, the bank, you know, to go get your blood drawn. I saw one last week driving. And so it would be nice. Maybe we can get more of that out in the community somehow, to target certain areas that may be underprived, to where transportation is the issue or things like that, to try to get people involved more with their health, to not pacify things off as, oh, it's something small, it's nothing serious. Because I think that, you know, is a big thing too. Not looking into your health.
Yeah. Yeah. Now, even now, think about it. Oh, I'm going to put this off, for whatever reason. And then there's COVID again, stops you. Like, okay, well, maybe I shouldn't go now, but.
But you know, Ricky, you hit a very important point. We know that COVID will start to die down towards the end of March. So there's got to be a push towards making sure that if screening is delayed, that there has to be the very aggressive push now to get on the schedule for March, April. And just kind of thinking ahead of, I can't predict what the virus is going to do, but I know I'm keeping it in line with the flu-like months. Yeah. So if we're going to be pushed away or delayed in screening, then once that virus starts to drop down, we need to make sure all women are just in line, or having a discussion about scheduling and being more proactive with and pushing the clinicians. I know it's difficult. I know sometimes you may have to have a mentor or someone to team up with, but we need to make sure that once the virus starts to drop down, we need to start making sure all women, if you delayed your screening, because what they were doing was stratifying care. So if it wasn't, you know, we can delay you a couple of months because it wasn't a high-risk disease. So I'm putting Black women at high-risk patients. So you can't be delaying Black women. And then I'm not saying to separate that from any other ethnic group, but I know just that from the articles that are presented about Black women in relationship to aggressive disease, they're at the head of the pack. So if they're at the head of the pack, then they need to be at the head of the pack when it comes to making sure they get screened. Mm-hmm. And I want all women to get screened. I'm not saying I want to be clear. I just know that Black women have a higher incidence of a very aggressive disease. And so we at least make sure they're out front, getting those tests, getting those treatments as quickly as possible.
And that is that. Oh, I'm sorry.
Go ahead, Luna.
I was just going to say that that's a good point, because the other day I had a DEXA scan scheduled, and I postponed it because of COVID, because I thought, well, you know, that's okay. It's not like it's my ultrasound or anything like that. They scheduled me for March, and I was like, what? How can that, you know, you don't have anything sooner than that? So anyone that doesn't really want to go right this minute for a lot of things, I mean, if you have a symptom, you need to go now. But if you're just going for screening, call now. Encourage, you know, your friends and family members and everyone to call now, because like Keith said, when the numbers go down, then everyone's going to start calling, and then there's going to be a bigger backlog. So the idea is just get on the schedule whenever you can. But it's taking longer for everything to get scheduled because the numbers are the numbers that they're processing every day are less.
Yeah.
To keep it safe.
Yeah, to keep it safe and less people getting. But how about like a March to Your Mammogram campaign? You know, my marketing brain always kicks off. Maybe there's something about, you know, March to Your Mammogram. I'm going to work on that. But I think it is really important to think about making appointments. Like if you're afraid to go, just at least put the appointment on the books. Yeah.
Hey, Ricky, I was thinking about a campaign for even Valentine's Day, sending someone you love for a mammogram, or even maybe Christmas in April, Christmas in May. A lot of people didn't do anything around the holidays because of COVID. So get out and do something for someone you love.
That's a great idea.
Or you can always do March to Mother's Day.
Yes.
Mother's Day, yeah.
I love that. March to Mother's Day.
From March to Mother's Day, get your screening. So, or March to Mother's Day.
Right, March to Mother's Day. I love it. Okay.
Seeing that we're on this monthly theme here, if you didn't know, April is Stress Awareness Month. So, I mean, you could even do something about, take the stress out and, get your mammogram, that type of thing. I think there's been some gems in the time that we have shared already, some things that I'm going to take and run with. And, just kind of moving forward from here. We have the information to put it out there, to know that if you want to get your mammogram in March, schedule it now so that people understand kind of the backlog part of it. I know that we talked about triple negative a couple of times, and I'm really grateful for the partnership with HBCUs. I know with the work that I do in Delaware around triple negative breast cancer and how it is impacting young women of color, I reached out to colleges because we can't wait until women are in their 20s to start having the conversation. I've heard one too many conversations of a young woman of color saying something didn't look right, didn't feel right. I said something to my doctor. He said, "You're too young for breast cancer. Come back and see me in a year."
Right.
And that's what they did. And not only is it breast cancer, it's triple negative, and we lost a year of treatment options.
Right.
So for you all to have that partnership to start the conversation then, to get young women to see, you have to be your advocate. If it doesn't look right, doesn't feel right, and you get that kind of response from a doctor, go find another doctor.
Go find another doctor all the way.
Absolutely, absolutely, because we're not trusting our womanly intuition. We're not entrusting our gut that something is wrong and we need to do something about it. Keith mentioned the bus. In Delaware, we had a mobile mammography van that traveled the entire state of Delaware, especially in those places that are, an hour or if not more from a diagnostic imaging location. And we actually lost our bus. We lost our bus because there were so many diagnostic centers popping up that we lost the bus. But I will certainly reach out to that. It's called the Delaware Breast Cancer Coalition. Reach out to them to see if it is truly out of commission, because that may be a temporary fix for what's going on right now.
Yeah,
So,
we have my doc, Regina Hampton, has a great bus here in DC, and I know we do a lot of fundraising to support the bus because they're very expensive. And I think what's expensive about them is actually transmitting the data to a facility. So once they actually do the mammogram, they have to have this technology to transfer that information to a diagnostic center to have it read. And I think that's where a lot of cost is involved. But I know we had a big fundraiser right before COVID for her bus to get on the road, not only the insurance and the driver and all that stuff, but just the technology is pretty expensive, but it's got to be a way to get people into the community, to get these tests done. So
I really loved Laura's idea about while you're waiting for your COVID shot.
Love that.
Look at your mammogram. I mean, if you all put that together,
I love that.
You're connected to like almost everybody in the world. So if you put that together and get it out to people like myself and others who have points of contact in their states, we can make that a whole movement. I think that's great.
I love that.
thing about connecting, you know, with the moms and the daughters and taking them to their appointments. And, you know, while I'm here, let me get mine too done as well. I think those are great things. And I just want to say that, you know, when I talk about us being superwomen, I've actually, just the teacher in me, I've created Superwoman University. And Superwoman University isn't about being a superwoman, because that's stressful. So it's about embracing what's super in every woman and getting women to understand that, because we play such a vital role in our families, to understand that self-care isn't selfish, it's essential. Because if we go down, then the people that we touch personally and professionally have the potential to go down as well. So we need to not think about self-care as being selfish or a me first, but think about it as me too. And how we need to kind of change the paradigm, because everybody knows that this whole cancer thing has been this kind of big C word, this hush hush under the carpet. We can't afford to do that anymore. We need to have those conversations with our families about what's going on, our family medical history, because it impacts us and it impacts future generations. And we want to be able to turn things around for future generations so that they have better opportunities as it relates to their health and wellness and their well-being, which in essence is being well.
And I wanted to say one thing, that because just speaking with a lot of women, there's this one thing that, and even with men, they're falling in the same category. I have cancer. You said you gave them the big C word, and then I'm going to die. It's very important to have survivors up there, because that lets them know that, wait a second, I'm not going to die tomorrow. I mean, 16-year survivors, 18-year survivors with breast cancer. I can live. And so there's that fear that everyone has if I have cancer. And it's, how do you educate everybody? And that's kind of what we've been trying to do, is just making sure we can educate as early as we possibly can, because you can live. It's not, I'm going to die. It's like, oh, I'm just going to recreate or redraw my path. I'm going to write my path in pencil so I can erase, because the cancer may come back, but there may be a clinical trial, new therapy that will slow it up a little bit more. And we just keep on kicking it, hitting the puck down the ice more and more. And because women are living longer, and they just need to hear that message. You're not dying tomorrow. So don't think you can tell everybody, because if you can pass the message along and talk to people and place yourself in a vulnerable state, which is difficult, then everybody can help. So that's my point I wanted to make.
I love that. That's all great. I love it. Thank you guys so much. Thank you so much. So I don't know how much of a voice I will have in this sort of Biden-Harris. It's like the Committee for Black Women's Health. And I guess it falls under the Council for Women and Girls, but I will definitely use whatever voice they give me, whatever platform I can talk on. So if you have anything that you want to talk about or want to bring up, you know, call me, text me, email me. You can reach out on, you know, our all of our social media is Touch BBCA, Touch the Black Breast Cancer Alliance, and info at Touch, Ricky at touchbbca.org. And I will get all of my friends to help me. So thank you for being my friends. I love you guys so much for even doing this with me today, but we'll keep up this conversation. You know, I think we should have it again in a month, you know, and I'm going to work on all these ideas. I'll throw some stuff back at you guys. And if you have ideas, you know where to find me, but let's regroup in a month and see what things look like once sort of Biden gets into play and this whole 100 days thing. You know, I'm a little worried because the numbers I'm hearing about the vaccine are kind of crazy right now. Something like 40% of medical professionals in Florida won't take it. Crazy. And then, you know, my concern is like, why would a Trumper who refuses to wear a mask and goes to an event with, you know, 40,000 people, why are they going to take the vaccine? So I don't know.
Well, Ted Cruz took his vaccine and was on and was on social media with it. So
Really?
some of them may surprise you. I couldn't believe he had the nerve to go on.
Well, I
That's
mean,
pretty wild.
Ricky, you bring up a very important point about vaccinations and the disparity of distribution of vaccinations. Is going to be important. So that's why it's going to be very important for us to be very aggressive with maintaining the distance, the mask.
Yeah.
In addition to the vitamin C, there is one other thing that I tell everybody to do, and is that when we're talking about the virus grows and propagates in the upper respiratory tract between your nose and your throat. So I have everyone, in addition to the vitamin C, is making sure that when they wake up in the morning, they irrigate their sinuses and flush everything out. But also, it's kind of old school and if you're from the South kind of country, that if you use a little dab of Vaseline to coat the inside of the nostrils, it serves as a barrier to the virus entry. So when you wake up in the morning, I have people do a 30-second gargle. You tilt your head back, and then you bring everything forward and push it forward. Then you gargle another 30 seconds, and this is with old school Listerine. It's all over the counter.
Yellow stuff, right?
Yellow stuff, or the original, or you can use a Cool Mint, which is that green stuff. You gargle deep, 30 seconds, and you'll see the phlegm flush forward, come out. And then you do a front gargle, right? If anyone in your families comes down with COVID, the problem is they need to stick to this protocol. And also, every person who does develop some kind of congestion, because they're not admitting you to the hospital now, they're sending a lot of people home. So you have people, if you do 10 deep breaths, and then it expands the lungs. So it breaks up the mucus, maintain, and then you can cough everything forward. So if you have it, you're going to cough it up, push it out, gargle in the back of your throat, gargle in the front of your mouth, and then make sure you do your nasal rinse ahead of time. And that has to be done religiously, because the people who that have been using it have come back. It reduces the symptoms and decreases your chances of developing pneumonia, along with vitamin D. This is what I was telling people back last March. Consistently, I'm telling people now, it works because we can't wait to get the vaccine. And there are a lot of people who won't take the vaccine. So I can't address those people. I can't tell a person not to take or take the vaccine, but I have to tell everybody to be prepared. If you're a cancer patient, be prepared and protect yourself. And these are just ways that you can protect yourself.
Thanks, Dr. Keith. I think Amanda just came on. Are you here, Amanda? My daughter just came on. She's hiding. Amanda, put your
I am hiding. I am hiding.
Put your camera on. I just told her to come on. Oh, just say hi.
I'm driving.
Okay, so Amanda is the executive director of Supermajority. Can you just describe it real quickly, Amanda? Tell them what you're doing.
Yeah, of course. Supermajority is a women's equality organization, and we are working really hard to build a movement of people that believe in gender equality and are ready to fight for it. So do a lot of training work, leadership development work, and then advocacy work on issues to help women.
So we have some really great ideas, Amanda, that came out of this that I'll tell you about to talk about women's health. And so we really have to, I think we need to be part of your platform, because what I say about single moms and getting screening. If we don't do cancer screening, it's going to look really nasty in a year. So all women need to be doing a better job taking care of themselves. Amanda lives with all these, the superwomen with the capes, Dr. Keith. So she's doing really good work. So you should check out our website, supermajority. Is it .com or .org, Manna?
.com.
Okay. So
you can help train me.
Yeah, follow her stuff. It's really awesome.
Happy to, Dr. Keith.
Thank you very much. Because we got a message to deliver, and it's all hands on deck. And I say it again, the tide raises all boats.
Yeah, we're hoping that supermajority becomes a party. So we have Democrats, the Republicans, and the supermajority. Because women, what, Amanda, say how many women more, how strong we are? Amanda, what's your?
Well, no, just 7 million more women voted this year than they did in 2016 even. So the movement is pretty incredible, but recognize also that this is the long-term work to fight for gender equity. And right now there's nothing greater than helping women come out of this pandemic, come out of the last 4 years even, but we have to come out stronger. And so we're doing a lot of work this coming year, specifically related to COVID relief. So I think there's definitely a ton of synergy here.
Coolio. Coolio. Anybody have any last thoughts? And we went over the hour, but I'm so glad you guys are here. Any last thoughts? I think we have some great ideas.
My last thought is probably maybe changing the face of cancer a little bit, especially with breast cancer. You know, I was 40 when I was diagnosed, but I did not see anybody in the waiting rooms and during the chemo, anybody that looked like me. So I always kind of felt like, wow, how did this happen to me? It's something that I never thought would happen because breast cancer does not run in my family. So I think that maybe, you know, in now being a new cancer survivor, I've been, you know, embraced to meet other women who are young, you know, and have young kids and things like that. So it's not like a 50, 60 older, you know, disease or one specific race more than another. It's affecting all of us. And so it'll be nice to kind of see more on the booklets and handouts, more of the 20-year-olds or the 23 or 25, 30, 40-year-olds that has cancer to change the face of it. And I think that would impact people more, especially to be like, okay, not to be dismissive of their health.
Mm-hmm. Yeah. Yeah. And you know, I feel that way about the whole clinical trial conversation, you know.
Oh yeah, so that's the whole.
More to come on that. But yeah, we're building our research probably in 2 weeks on basically how to change the messaging around clinical trials for Black women. So we hope to have some data at the end of March, and you know, then we're doing a quant study after that. So I hope we'll do this work. So
Ricky, can you just push also genetic testing? Because
genetic
Dr.
testing.
Nicole.
Yeah, I'll tell you a story about that. My college roommate, she's actually a city council person in Cincinnati, Jan Michelle Kearney, and she had breast cancer a year after I did. And she had stage 2, I think ER positive breast cancer. She did her treatment. She went for a checkup 2 weeks ago for her oncology checkup. And her doctor, kind of out of the blue, a new doctor came into the practice and said, "Did you have genetic testing? I don't see your genetic testing profile on your records." And she said, "No, I didn't. No one ever asked me about that." And it's so funny because we talk about cancer all the time. And it turns out she has BRCA2. And on last Tuesday, she had her ovaries taken out and had a hysterectomy. But it's been 8 years. And so in all that time, and she, you know, she went to Harvard, Dr. Keith. So she got her master's and her law degree at Harvard. She was actually in Barack Obama's law school class.
She didn't listen to you. So
I know. She went to Dartmouth undergrad.
Because we really feel that genetic testing is going to be important, because now moving forward, the new therapies that are coming down the pipeline can focus on what your genetic makeup is. And the other thing about for African American women, you have to get genetic testing. We have to move you guys into the clinical trial space, because the majority of genetic information is based upon people of European ancestry, and not more people from different ethnic groups. So there's, I think 83% of all genetic information is European. So we have to make a change, because the new therapies that are coming down, like the PARP inhibitors, these are drugs that prevent the cancer from repairing itself. We have immunotherapies that are coming down the pipeline, like antibodies that blocks that puts the brake on the cancer. So it allows the immune system to turn on. all these technologies are coming down the pipeline, but if you don't know what the genetic makeup is of a particular ethnic group, then we can't choose or design the therapies that best meet your needs. So the 21st century medicine, it's very important now, because everything is going to hinge on what your genetic makeup is. I'm not saying everything. I'm not saying 100%.
Well, Judy had a kidney transplant. She has a genetic kidney disease, and her son actually has the gene, right? So it's really across every disease that we need.
Yeah. And so that's where now all of a sudden it's not just prostate cancer, breast cancer. I'm BRCA2. Also, my mom, it was BRCA2 positive. So the probability I'm BRCA2 positive. And my father had prostate cancer, so I'm at a higher risk.
Right.
So now that tells me when I need to start screening.
Right.
So I needed to start screening when I was 40.
Right.
I didn't start screening until I was 55. So it's this period of time that we all have all these collective minds together, and the supermajority has that ability to drive and change the care for all women. Because this is important. And I know I'm on my soapbox again, because I'm letting you know the majority of scientific information was based upon a male's physiology.
Oh yeah, we know that.
And so now it's time to shift that and make sure all these new therapies that are coming out are balanced. So, but again, genetic testing and clinical trials.
Yeah.
Well, Ricky, I'd like to say something.
Please do, honey.
Okay, I can't tell because my iPad died on me and I'm on my iPhone.
Okay. We see you. You see you.
Oh, So, speaking about my genetic disposition to glomerulonephritis, I was diagnosed actually my 9th month of pregnancy with my first child. And I didn't have a biopsy. My physician, nephrologist, basically just did a family history. And so my dad had this hereditary condition and he passed at 43. He couldn't get to dialysis fast enough and it was terrible. Then I had an uncle who actually was diagnosed. I think he was about 50. He had a transplant, but he actually passed from, I think the results of a blood transfusion. I guess he got hepatitis or something. Anyway, and then, so fast forward, my oldest nephew is on dialysis now. His brother was fortunate enough to get a kidney transplant, actually a year before I got mine. So the importance of genetics is critical in discovering all types of diseases. And I agree with Dr. Crawford on this. And I think the earlier you get this type of testing, it's better than getting it later. So I would advise, kids in their late 20s, early 30s to get this screening. The way my youngest son was discovered to have it is that he kept getting gout, which we know what happens with gout is that, you get crystallization in your bloodstream, which causes this painful reaction in your toes, mostly your big toe. So he kept getting these gout attacks. And so he went to see his physician. His physician said, well, I'm going to order a biopsy. Based on my history, my family's history, he got a biopsy. And the biopsy discovered that he had the same type of disease that I have. So, this genetic stuff is serious, very important.
She was blessed that her daughter gave her kidney.
And yes, my daughter, thank God, she was a good match. And she made the sacrifice.
Yeah.
So I'm very fortunate that I didn't have to be on dialysis too long. Actually, I almost died from waiting for a kidney transplant.
You did.
Because my levels went too high. I was like, I don't want to be on dialysis. I don't want to be on dialysis. And I spent 3 weeks on it. And God bless my sister, Ricky, because she sacrificed a lot of time to help me through this. And I appreciate her dearly. She's a wonderful woman and she loves a lot. Mm-hmm. She gives a lot.
You took care of me too, honey. So.
Oh, thank you.
Yeah, you know, when I was sick, all my friends from my whole life came to take care of me. And we never talked about it because they knew that I would never ask for help. And so they just showed up and started doing stuff and like literally stayed with me for a year. And so we started a club of us called the SMAD Sisters. It was SMAD Sisters Making a Difference. And so we have like a prayer call every Sunday night and we hang out and help each other out. So we, you know,
yes,
what we do.
Very good.
So, yeah. So
but
thank
I want
you.
to say,
Go ahead, Jen.
I want to say in terms of mammograms, I got my mammogram and I'm immunocompromised. So I have to be very careful.
Right.
And they assured me that the facility was safe. Everything's cleaned after every person, wear your mask. I said, okay, well, I'm going to come in because I know this is very important.
Right.
So I got my mammogram. And after a few seconds, I was comfortable.
Right.
So, you know, I don't think people should make it a big deal because of COVID. You know, it's very important, especially if you're a certain age and, you know, you have a history in your family, even you don't have a history in your family, because we know that many people get breast cancer who don't have a history in their family.
Right.
So
I think people need to hear our experiences to know that it's safe. I know when I work with survivors here in Delaware and beyond Delaware, you know, to tell them, you can ask questions, you know, ask them what their COVID protocol is. Ask them, can you sit in your car until it's, and when I finish the conversation, they're like, oh, I didn't think about that. I didn't think that I could do that. It's like, yes, you can, because you do need to be comfortable. You do need to have that trusting relationship. So people need to hear, you know, that it is safe, but to ask the questions so that you're comfortable to do it. So I think that's where we as survivors and thrivers and supporters need to speak up so that our voices are heard and to know that it is okay.
Yeah, yeah. Because that's
go ahead. Sorry.
The message that everyone has is from the media. I mean, even if you look at the virus, it looks like a small Frankenstein monster, and everybody's afraid. But if we have that continued message, you can get through this. You follow the protocol, and it's, to a certain extent, it's safer now, because if you're waiting in your car, there was a time when you would walk into your doctor's office and everybody in the doctor's office was sick.
Had the flu. Yeah.
Had the flu. Well, you might as well contracted the flu there.
Right.
But now the concept here is the lower your exposure concentration to the virus. That's it. That's why there's 6 feet, because that's the concentration of virus that makes it to your body is decreased dramatically over 6 feet. And if you're not walking to a room with crowded numbers of people, the concentration of virus per unit area in that room is low. Your body has the ability to fight off, I call it like weeds in the garden. If you go in and pull out a weed every day, the weeds don't take over. But if it's a high concentration of weeds, or in this case, high concentration of virus that you're exposed to, then it takes over. It becomes very difficult for the immune response. And even in Judith, or Judy, if I call you Judy, you're immunocompromised. So we have to make sure that your immune system is optimized to defend, and you're doing everything else. And there's one other thing that comes into play. Once you're confident and you're not stressed, stress weakens the immune response. Fear weakens the immune response.
Yeah.
If you're confident, you got this. When was the last time you heard somebody say, we got this, we're going to get through this?
Exactly. Yeah.
All right. I was going to say, how about while I'm waiting for my vaccine, I'm getting screened. We're going to do a little video campaign. So Judy, make me a video I can post that said what you said about being immunocompromised. And we'll post it. Anybody can, and we'll post it. All right. So we got to go. We're way over time. I so thank you. Tune into our Dr. Zinn show on Wednesday. Nicole's going to be on talking about breast cancer and divorce.
And which Nicole?
That Nicole. And,
Oh,
and
I was about to say, because I used to talk about divorce and separation. I'm like, how's she know? I didn't even know she knew. Okay.
you want to be on too? If you want to be on.
No, I'm good. I'm gonna let Nicole do her thing. I'm gonna support her.
All right.
I was like, she said she's good. I was like, all right.
And Nicole, you know what? You gave me your topic for your show down the road, Superwoman University. All right, so we'll get that down the books. All right, thanks, everybody.
I just want to say thank you for allowing me on this great
I
panel.
know you did good as our only man.
I said, well, I mean, I have some role models. Because my mom used to hit me in the back of the head a lot. So
I'm a PV alum.
Oh, okay, see that? So Sarah.
And we'll make sure you have your shirt, Dr. Keith. We'll make sure you get your shirt.
I'm waiting for my shirt.
All
and
right.
I'm waiting for my little touch hat too,
Okay. Okay. All right. Thank you, guys. Have a blessed day.
Everybody.
Be safe and healthy.